Hello again, everybody. This is Dr. Greg Pursley. Please call me Dr. G with Dr. Aaron Andrews. And this is Between Two Spines. And today we have an extremely special guest. We're going to talk about COVID. The coronavirus, right?
A bonus episode.
All right, a bonus episode. This is Maria Davis, and the reason why I have her card is because she has an amazing title, and that's the Cape Girardeau County Public Health Center Health Educator. And there was no way I was going to get that right, so I wanted to make sure I read it off of the card. She got married about a year ago and also had a different last name, so I had to make sure I got it all right. So we're going to talk today about coronavirus, COVID-19, and what the Cape Girardeau County Health Department wants you to do, and why it's important to take care of yourself and that sort of thing. So welcome to the show. I appreciate you doing this. Thanks for being here.
Yeah,
thank you very much.
Thanks for having me. I'm really excited to do this. You guys reach a lot of people, and it's nice to have a discussion about this stuff, and I felt like this is a really great way to do that.
Yeah, absolutely. So many people come up with opinions, but they don't get the facts, and that's what we wanted to talk about, the facts. And right when we got started, you mentioned something extremely important, and I want to put this in the front of the episode, which one of the best ways to protect yourself against this virus or any virus, and what did you say?
Yeah, build your immune system.
Build your immune system.
What do we do all day long?
We do this all day, every day.
Every day we boost people's immune system.
Right.
So if you didn't know, your immune system is mostly controlled by your nervous system, which is your brain, spine, and nerves. And what do we do every day?
Every day. We talk about it. So we really focus on three things: joint mobility, muscle tone, and nutrition, which all leads to nerve function and immune function. So it was so amazing to see. I was refreshed. I was like, yes, the Cape County Health Department's telling us maybe we should focus on boosting our immune system.
A lot of water, vitamin C, vitamin D now has been proven, very beneficial for your immune system. So there's a lot of things that you guys can do to stay healthy and boost your immune system.
That's
Absolutely.
Right. So tell us some information, some things about the whole coronavirus and all the things that you know or that you've been dealing with here.
Oh, wow.
That's a big question.
That's a lot.
That is
We'll just
a
sit
lot.
back and let you talk for about an hour.
Well, obviously this is a new virus, and we're learning new things every single day, and you'll see that with the changing of, recommendations basically daily as well from CDC and the state, the Department of Health and Senior Services, and coming from us as well. So the more we learn, the more we're going to share with you. But right now we know that this virus is spread, of course, through droplets. From speaking and laughing and talking and coughing. And we do know that can actually be spread at least 2 days before you start showing symptoms. So that's kind of why we have the masks and why those are important, and making sure that we stay 6 feet apart, disinfecting our surfaces, and making sure we wash our hands.
Yeah, one of the ways that you can transmit as well is touching your face, and so that's why washing your hands is so important, because when you have the mask, if you don't wash your hands, you're touching your face. You want to make sure you don't, transmit that to.
So one of the things you mentioned was the incubation period of the virus, which again is, depending on which article you read, is different, but 2 days to 8 days, I think is something that a lot of is the consensus, correct?
So it's 2 to 14 days from your last exposure to the virus. So whether you got that from someone else or off of a surface. And from that, we are seeing about 5 to 7 days is usually when someone starts having symptoms, but it is possible for them to onset on the 14th day.
So can they shed the virus during the incubation period when they're not contagious?
So they can shed the virus, yes. They can spread the virus whenever they are infected and during that phase. So about what we say is 2 days before they have an onset of symptoms, they can be shedding the virus, and throughout that whole period. But of course, there's our asymptomatic individuals, and with that we have to do the best that we can. Of course, asymptomatic people are not what we would consider the most likely big spreaders of this virus. It's more those people who are asymptomatic.
Who are symptomatic.
Who are symptomatic or pre-symptomatic individuals. So those people who haven't had symptoms yet, but they're about to.
If you're running a fever and you don't feel well, don't get around people. That's that's the main, that and boost your immune system via nutrition and vitamins.
What is the percent that you found that are asymptomatic, that are carriers?
So with the amount of testing that we're doing now and doing these community testing events, and even with younger children being tested, it's going up. I can't give you an exact percentage at this point, but it is really increasing. And we are doing a lot of testing now of individual who's asymptomatic with their contacts. And so we're finding lots of household contacts. So a lot of
which will get worse with the cold weather.
Yes. Yeah. Having people inside more is definitely going to increase their chances of spreading the virus. So
do you guys track false positives or false negatives, those type of things? I mean, is that something you all track here?
So it's really difficult for us to say what is a false negative or a false positive. Of course, it's more likely that you're going to have a false negative than a false positive, just like with any type of test. But it's really difficult to say. And so we really have to go off of the test. And sometimes we do, for an individual who is a close contact, is having symptoms, but they got a negative. For those individuals, we do consider them probable cases. And so we kind of follow the same guidelines that we would with a confirmed case.
Do you guys do testing here?
We have a rural health clinic, and so we do some testing here, but we really do reach out to our partners in the community to provide most of that testing.
Where would you recommend people go get tested if they want to?
There is so many urgent cares, and the hospitals both have hotlines that actually screen people before they get tested. So really just reach out to your local physician to get tested.
One of the things that we have seen talking to patients and people in the past that have had it is the slow turnaround on results. Is there, it takes 2 to 3 days to get it, and so people are confused, what do they do? And so that kind of is...
Yes, it is taking a little bit of time. Now it is much faster than it was in the beginning. We do have more rapid tests now, but of course with rapid tests, you are more likely to have inaccuracies. So we are seeing a little bit more of that. But of course, it's taken about 2 days is what we're seeing. And then it even takes longer for it to be reported to us. So it has to go through the state, and then the state informs us. So that is taking a little bit longer. So we may not get to an individual, a few days after they've actually been tested and know about the fact that they are positive.
When you get a positive here, you track that individual down and then find out where they've been, and that's your job. That's
right. That is kind of part of the case investigation and then contact tracing. So with those case investigations, as we get a positive, we basically reach out to that individual, see where they've been in the past 14 days, so where they could have been exposed. And then we also see who have you been around those 48 hours prior to getting symptoms or being tested. And then since then, who have you been around? And from that, we reach out to those individuals. So it's a really long process. One case can actually take, an hour to, 3 hours, just depending on how many contacts an individual has.
Yeah, that's got to be a tedious process for sure. Yeah. And the room we're in now, you guys are saying that you're converting this room into a tracking room, if you will, right?
Yeah, basically like a call center.
Yeah.
So we're turning this room into our contact tracer call center, so that we can hire more people and really get to more people for contact tracing.
Wow. A lot of people are talking about an article they read in the New York Times last week saying that we're in the top 5 or top 7 of the, not most cases, but highest percent per capita. Is that true? Is that?
We are seeing a huge increase in our area, and ultimately in the beginning it was in those larger cities. And it's just, we're being hit with it right now because, we weren't in the beginning. And so as we don't have a population that has any type of immunity.
Right.
So it's spreading really quickly right now. And so it's really important to take those measures.
Yep. There's a lot of people. So I was listening to a Harvard epidemiologist the other day, and I wanted to share it with you because he explained it to me, and this is how I explain it to my patients and friends when they ask me about it. So he said, you know, that you guys are getting data like they're drinking out of a fire hose. You know what I mean? It's just coming at them. And one of the things that he had trouble with is all this data, instead of coming to one place, Harvard gets some, the CDC, the WHO, you know, different universities, and then everyone's interpreting the data a little bit different. And then you've got data in other countries that are interpreting it different. There's different mortality rates, different infection rates. And so he said, you know, no one's really agreeing on the hard facts. And then you add people's opinions and philosophy and politics, and then it just goes haywire. So now what he was upset about is, you know, there's a whole spectrum of opinions, and someone could say, well, it's nothing, it's the flu, and they can find an article that says that. Or you can have someone on the whole other side says it's a zombie apocalypse, and they can find an article that says, you know, it's close to that. And so, you know, I wish, and I'm glad that you guys put a lot of information out there, I wish there was an unbiased source of cold hard facts for people to see and read and agree on, instead of all this mess.
And ultimately, it's somewhere in the middle.
Right.
You know, we don't want to scare people. We just want people to take those proper precautions, because it is very preventable, and we can really control the spread. And this is how we've been dealing with diseases for a very long time. We've done contact tracing for years and years and years. So this isn't new stuff for us. It's just on a way bigger scale.
So basically, like you said, the steps to prevent or to take yourself out of harm's way, or at least limit that, are number one is the social distancing aspect, especially if you're going to be in closed spaces. Number two, boosting your immune system. That's another very important one. Wearing a mask if you're going to be in social spaces as well, to stop the droplets, that sort of thing, right? And then what was the other? Oh, don't touch your face.
Yeah.
So don't touch your face or wash your hands. Both are very important. So washing your hands. Those are the main four I've heard over and over and over. But boosting your immune system is the one that I don't hear a lot being spoke about in public. So that's something we want people to understand, and we'll give some tips on here in the notes to talk about how to do that and make sure you get access to that information.
You mentioned the droplets in the air, so I'm going to put you on the spot and ask you some more direct questions that everybody wants to hear. So those droplets, they can hang in the air.
Yeah.
And people have heard different time where people get infected from those airborne droplets. What is the consensus research on how long that those stay there?
It really depends on the space and how well that area is circulated. So if you're outside, obviously, air is circulating really well, and so it's less likely that the virus is going to spread in air, and we might be able to handle being a little bit closer. But we still, with those masks, we have that extra protection if we're going to be close. But of course, if you're walking down the sidewalk by yourself,
or driving by yourself,
you can take your mask off.
Right.
Is there any data on surfaces that you guys have seen?
So surfaces were really kind of the focus in the beginning, because we thought that that's how it was being transmitted. But it is really, the more research we've done, we found it is those droplets. It's more likely that you're going to get it talking to one another or coughing than off of a surface.
Yeah, I read it was less than 5% chance off the surface.
So basically, if you wash your hands, keep your immune system healthy, as well as your body.
Wear your mask around people.
Wear your mask around people. You should be pretty darn good. I mean, really. I mean, that's the consensus there. That's good.
So speaking of, sorry, these questions just keep popping in my head, and I know everybody wants to hear.
Just so you guys know, he's like an ADD squirrel. One question, another question.
Well, I know what I would want to hear watching this video, so I'm trying to think of things that everyone talks about and no one agrees on. You know, so the contagious rate. Yeah, again, I've read twice as contagious. I've read 10 times as contagious, and they always talk about the flu. You know, no one ever talks about any other disease. They always compare it to the flu. How contagious compared to the flu, or however you want to describe it, is COVID-19?
Okay, so kind of what I've seen is with the flu, normally if one person that has the flu spreads it to one other person. Whereas with the coronavirus, we're seeing it spreads to 2 to 3 other individuals. However, in households, it's really crazy.
Super spreader.
It is a super spread within households. We are seeing, they've said 25%. However, we're seeing way higher than that. I would say, 75% of the individuals in a household actually get it.
Are gonna get it, yeah.
Mm-hmm.
So that would be.
If you got 4 people in a household, one person gets it. The other, or 2 of the other 3 are gonna potentially.
Exactly, and that's why it's so important that if one person gets it, they isolate themselves away from the rest of the household. So going to a bedroom, bringing food to them, and really keeping them in that bedroom as much as possible.
So basically, just get a hole in the door and slide some food in.
I know. It's it is kind of scary with that, but it is the best way to keep the rest of the family from getting it.
Now, what about actual death rates? Because it seems to me like death rates are going way down, lower and lower and lower.
Yep.
Why is that, or do you have any data on that?
So basically, we're learning more and more people have it. So you're going to have your death rate go down. However, we're still seeing higher rates than we would like to in that older age group and those vulnerable populations. And this is higher than flu or other viruses like it. So it is still really important that we follow these precautions. And we don't have a true treatment. And right now we don't have a vaccine. So there is no way for us really to, treat this at this point.
The treatment is a hot button topic also. This medicine works. No, it doesn't. There's no research, Well, there's no research on any of this yet, And the research that's out there is from 10 cases or 50 cases, and there's not enough data to say one way or the other. So.
Yeah.
You're right, who knows?
Yeah, and I will say with our local hospitals, they've been using remdesivir and plasma, and that seems to be going really well. Our hospitals are doing an awesome job.
Now, how many cases are in the hospitals right now?
So, we got an update yesterday, and we had 42, which is our highest thus far in our hospitals. So.
How many current people have it in the Cape Girardeau area right now?
Goodness. I look at these numbers every day and it's just, they run through my head. And so I think we're almost at 2,000, but of course there's probably a lot more than that.
2,000 cases or current cases?
Oh, current, so your active cases. Active cases, okay. So we're at about 470 is what I think it was yesterday. Those are of course kind of reflected of can we get to those recoveries though as well, because sometimes that can take a little bit of time. We do try to call all of our cases to see, hey, how you doing at the end of their period, to see if we really can recover them, but that of course is becoming more and more difficult as we get more cases. So yeah, that's we've got about 470.
Wow. Well, thank you very much for all the information, and I know we peppered you with questions. It was like a shotgun, pow, 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 just peppering you.
Yeah, I know. Is there anything else you want to add? Where do you see this going by Christmas?
I know.
Yeah.
I cannot predict the future, but viruses, they don't go away. They are continuing to spread. We do expect exponential growth, of course, so more and more cases.
We're still going up.
We're actually hitting our first wave now.
Yeah.
We're still in the middle of our first wave here in Missouri. And so, again, we didn't have those cases in the beginning. But as more and more travel happens, as more and more people get out in the community, and it's going to spread. We cannot stop the spread. We can just control it.
Well, and generally during the winter months too, in the darker months, people have more of the stressors in their life, chemical which is what you eat, drink, and breathe, mental, emotional, and physical stressors. You know, there's not as much sunlight, you're not active as much, you're eating worse, you're drinking more things with toxins in them, and that takes a toll on your immune system. So you want to make sure that you boost your immune system, or you want to make sure that you stay physically active and, you know, mentally and emotionally as well as possible. All that stuff matters when we're talking about your immune system. So during the colder months, that's extremely important to stay ahead of, and we want to make sure that you're aware of that as well.
Yeah, and again, we'll put 4 or 5 things down below this video, and we have a couple videos if you scroll through all these and go on our Facebook page about boosting your immune system, vitamins to take, things to do, exercise, sleep. There's a lot, so we will definitely post some more below this video for you guys.
Yeah,
Absolutely.
yeah, and you know, the immune system, you know, we're really focusing on that right now because flu season coming up. You know, we're going to have more likely more hospitalizations for flu and COVID. So we really still need to continue to do those measures. This will also help with flu, all of these measures.
I had 2 more questions that just popped in my head. One of them was about flu. So someone just asked me a question the other day, again, probably an urban legend. Will the flu vaccine make you more prone to getting the coronavirus?
You know, I can't know that.
That's the new rumor that's going around.
I wouldn't think so.
I've heard the direct opposite.
Yeah.
That getting a flu vaccination will potentially prevent you or help you from getting it. And here's the problem, like you said before, you're going to find both sides. So a patient told me, or asked me that question, and I said, look, there's not really enough data to know either or. But you have to be informed on your own. As a citizen, you should get the information and make your own decision.
They are 2 different viruses, so I can't really see it making a difference either way.
Yeah, because the vaccine has nothing to do with
Yeah.
it.
The overall heading is make sure you stay as healthy as possible, boost your immune system as much as possible, and do that through physical activity, drinking water, staying active, eating right, you know, all those things. That's really kind of the umbrella.
Yeah.
Have you seen any research on blood types? You know, some people say O gets it more, you know.
I don't
I don't
know.
think any of that is true. Yeah.
Well, once again, there's probably not enough data to really.
I don't think there's enough data
There's so
at
much out there.
at this
crazy.
point, but anyone can get this. I don't think that would be true.
I
It's
assume
a
you guys
virus, and
weren't
it
doing
doesn't.
research on it.
Yeah, it's a virus, and I don't see how it could differentiate between.
We need to have a little thing that
People.
says true and not true.
Yeah, true and not true.
And the answer is not true.
Well, she's really more, you know, geared towards data collection and that
Yeah.
sort of thing, not scientific research of how this virus is going to interact with the immune system over time. But yeah, I really appreciate you sitting with us and having this information. A lot of people, I think, are going to get great insights into what they need to do, as well as some insight into what's happening in their area. So, Maria, I really appreciate you. If we'll put a link here if anybody has any questions to the website that you guys, the Cape Girardeau County Health Department website. I know, that's right, the Cape Girardeau County Public Health Center
It's a lot.
Health Educator. And my gosh, and so
You guys do a great job. Your graphics are great. Your tables and
Oh,
Yeah,
thank
yeah.
you.
It looks good.
Yeah.
It looks really good. Yeah.
I'm
so.
saying thank you because I put all of that together. So yeah, keep
It's
it up.
easy to read. Here's the cases. Here's the active cases. Here's where they're at. And yeah, it's neat. If you guys haven't checked it out, check it out.
Yeah.
It'll give you a better understanding what's going on in our area for sure.
Absolutely. So one more time, thank you for doing this with us. This is Between Two Spines. I'm Dr. Greg Persley. Please call me Dr. G, Dr. Aaron Andrews, Dr. A over there. And we sat today with Maria, and she helped us out with the COVID, coronavirus, COVID-19, and helped us out with some health information for that. So once again, thank you. We look forward to helping you guys in the future. Have a great day, and we are over and out.